When it comes to keeping up with the health of the mind and the body, there can be some confusion about ways to stay ahead. For example, there's a theory that symptoms of depression and anxiety are because of some chemical imbalances in the brain. And so, in order to feel better, the patient should take medications that would balance the brain chemistry. Similarly, there are some various medical symptoms like chronic pain or irritable bowel syndrome or rheumatoid arthritis that are considered health issues that are to be treated by pain medications. The trouble is that patients with ongoing psychological or medical problems tell us that their medications often stop working after a while, or that they are experiencing their unwanted symptoms after all. I have learned in my clinical practice that proper management of health issues is primarily in the hands of the patients themselves. What I mean specifically is that patients' beliefs about their conditions, the kinds of thoughts and assumptions that they hold in their minds about the limitations of their conditions, actually make a huge difference in the amount of suffering that they experience. For example, a type of thing that I'm talking about is the case of a typical patient that I treat. Often the initial list of problems that we are looking at are depressed mood, hopelessness, low motivation, foggy head, poor memory, easily irritable, vague pain throughout the body, trouble digesting food, stomach pain and feeling bloated after eating, and painful and stiff joints, sometimes in the mornings, trouble sleeping, difficulties in relationships, both personal and at work. Now, during the initial phases of therapy, the patients would report feelings of anger, disappointment, feelings of inadequacy, sadness, anxiety, fear. And then when asking the patients to describe what's going through their mind, often I get the following types of comments. Things like, my life is just not how I had expected it to be. I'm not useful. I can't perform like I used to. No one wants to deal with me because I'm just too much trouble. Or that my health is just so unpredictable that no one wants to give me a job or take me seriously. Now, you may notice several types of thought distortions in those statements. For example, black and white or all or nothing thinking, or fortune telling, or mind reading, or discounting the positive. These are a few of the patterns of negative thoughts that are often noted. Such ways of perceptions bring about negative feelings of sadness and anger and despondency and hopelessness. Now, our work here at the Feeling Good Therapy and Training Center is based on the TEAM model. TEAM is an acronym, not that there's a group of people, but it's an acronym. And the TEAM model was first established by world-renowned Dr. David Burns, a psychiatrist out of Stanford. What this means is that the first few sessions are spent in assessing the patient's, essentially the testing part of the T. The T stands for testing, and basically what that means is that in the beginning parts of the therapy, there is an accurate reading of the specific levels of depression and anxiety and anger and even positive feelings. Now, we monitor these scores at the beginning and at the end of each therapy session, and over time we take note of the changes that the patient is making that indicates progress in therapy or potentially any slow progress. And then the E part stands for empathy, where with the most advanced techniques of empathy, we aim to understand the patient on a deep level, and we take such strong interest in learning things from the patient's point of view. For example, with the use of these amazing, powerful techniques, we get to hear what is it like to really be in that position. Not every patient is, of course, the same as another. The A part, or agenda setting, it's where during that period of time, the clinician and the patient together take a look at the situation from all perspectives, and they examine all the good reasons to change thought patterns, but also all the unwanted obstacles that might need to be accepted if the thoughts were to be different. So by the time the patient has agreed to any healing or any changes in his or her perceptions, he or she has had a chance to really recognize what this change might really mean to them. And then lastly, we tap into a very rich repertoire of more than 50 methods. That's the M part of the team model, and 50 methods and techniques that we can use to bring about the desired changes in the thought patterns or in behavioral patterns that eventually lead to relief from those painful feelings of despair and hopelessness. What's really exciting to notice is how health behaviors change often after this work, to where management of chronic pain or digestive issues or any other chronic health problems, the management of it becomes easier, and in fact often patients report a complete remission of those symptoms.